Namaste, I am Dr. Manaan Gandhi from Dr. Gandhi's Ayurveda clinic, and today we are going to talk about 6 stages of diseases. Most diseases don't come overnight. They take a while to build and they follow these 6 steps. Although some of them, for example, you have an accident or you have a fracture, will obviously be sudden. But apart from these, the 6 steps of disease formation is generally followed. Why is it important to know? You will find out at the end of the video. The first stage is accumulation. So it's either one of the functional abnormalities or the doshas, or whether it's an infection. It accumulates as the first stage of disease. The second stage is aggravation. It starts aggravating, it starts multiplying, it starts just growing within itself, which then leads to the third stage, which is spreading. It spreads to different parts of the body and it localizes, which is the fourth stage, into a weak space. Now for a few of you, let's say your weak space is the throat. So I know a lot of patients who will immediately feel an itching or will feel some problem in their throat, which will give them the sign that they're going to fall sick. They have a problem. So you could have multiple weak spaces wherein the disease will settle or localize. After localization, you will have manifestation, which is the fifth stage. Here the patient will start seeing proper symptoms, whether it is pain, whether it is burning, whether it is itching, or whether it is some other symptom. And the sixth and final stage is when the disease becomes a full-blown disease where you can use differential diagnosis and diagnose the disease and give it nomenclature. The problem is that most of the patients come wherein they're on stage 5 and 6, where they have symptoms, they have pain, they have burning, and then they come and say, you know what, it's burning too much, I need relief, I need help. Or they come in stage 6 where they come with a diagnosis, I'm suffering from psoriasis, I'm suffering from eczema, or I have asthma. So they come at stage 5 and 6, and for me that is a problem. Why is it a problem? Is you don't need to wait until the disease develops over years and years or months. You can easily prevent this. For me, this is the real health insurance. Not paying a hospital's bill and not paying its bed charges. The real health insurance is to prevent diseases. How do we do this? To find out whether the disease is in stage 1 or stage 2, the only method that is most reliable is pulse diagnosis, also known as Nadi Parikshan. It is one of our specialities. I have been doing Nadi Parikshan since I was 14 years old, and that is the only way that I practice. I don't even have a bed in my cabin to examine. But why is it so important? Nadi Parikshan is important is when you check the pulse, you are able to find out if there is any dosha or if there is any infection at a very latent stage, at a very starting phase, and we can actually catch a disease there and try to prevent it by using a lot of methods. See, when you catch it at a very primitive state, you don't even need to give medicines. You can simply give some dietary changes, some home remedies, some precautions, some preventions, and definitely you can also give a few preventive medicines in order to solve the problem, to nip it in the bud and not allow it to become a very big disease where you have to run to a doctor screaming help, help, help. So this is very, very important. I highly recommend every person to get their nadis checked at least 3 to 4 times a year with any Nadi Parikshan expert in their vicinity. So this was my take on health insurance. This was my take on the 6 stages of diseases and what you can practically do in order to save and help yourself and your loved ones. I am Dr. Manaan Gandhi. Please like, comment, subscribe, share this video if you feel it has any value. And that's it. Thank you.